Hello, thank you for taking the time to learn about StellaLife. I'm Liz Lundry, a longtime hygienist and the clinical education manager for StellaLife, and I'm going to be sharing the science behind StellaLife and the many applications of the StellaLife VEGA oral care system. Our mission at StellaLife is to improve people's lives by accelerating healing and relieving pain and reducing the need for opioids and steroids. And as we reduce the need for opioids, we are able to save people's lives. With intelligent healing, we're able to decrease swelling and bruising, and we hugely accelerate healing. And because the 16 active ingredients in StellaLife are derived from plants and minerals, they are natural. So it enhances patients' well-being. We have a very powerful anti-inflammatory and analgesic benefit with StellaLife products. And our rinse as an antibacterial is able to be used daily for oral hygiene. It also accelerates healing, reduces pain, and it does so naturally without any side effects such as burning or staining and some of the other toxic effects from rinses that we've been using so far. So as we look at StellaLife, we're able to use these products for all of our surgical procedures, as well as other common conditions that our patients present with, such as dry mouth, aphthous ulcers, other conditions such as lichen planus and oral pemphigoid that really haven't had many options for providing relief. With the surgical applications, using ideally the StellaLife Recovery Kit, which are 3 products that are used 3 times a day, starting 3 days before the procedure, we're able to, again, accelerate healing, reduce bleeding, and keeping our patients very comfortable so they have a really wonderful surgical experience. Here is how Dr. Michael Picos has been using StellaLife in his practice.
There's a 3-3-3 regimen we talked about. It's very impressive. Here's a typical V-plasty with Eloderm. Time 0, there's 5 minutes. Hemostasis is like boom, amazing. But keep gauze on it for a good 4 minutes by the clock. That's the key to a little compression and let it soak in, and bingo. Here's a case of just cytoplast over extraction sites. You know, again, tissue is beautiful, responds very, very nice. And then here's our typical, 48 hours later, that's what things look like. Very typical. It's amazing.
So when Dr. Picos is talking about the 3-3-3 system, he is talking about using the recovery kit, which he gives to his patients, and also using the gel chair side as our surgeons are doing. Such in this case, with the patient having full mouth extractions and implants placed, the gel was applied liberally with a swab at the end of the procedure. And you can see within 40 minutes, the reduction in inflammation and bleeding. And the patient is also going to be much more comfortable afterwards. This particular patient had this extensive procedure. She used the recovery kit starting 3 days before the procedure, and this is what it looked like after 1 week. This is very typical of the reports that we're getting from our clinicians with their surgical procedures. And the best part is that the patient said she was very comfortable and only needed to take 3 pills for the pain. So she is very pleased and obviously is going to be sharing her wonderful experience with her friends to bring her doctor more referrals. Here, there was a study done with over 150 people, and in this particular patient's mouth, same mouth, the StellaLifeRinse and gel was used on one side of the patient's mouth, and the other side, Paradex, was used. And you can see the difference in the level of inflammation on the Paradex side. That is one of the unfortunate side effects of chlorhexidine, whereas the StellaLife side, the tissue looks very healthy, and the patient is going to have a very comfortable experience. And this patient had the gel applied immediately after the sinus lift and ridge augmentation. And you can see again in the same patient's mouth, the difference between the StellaLife treated side on the patient's right side, again, the reduction in inflammation and bleeding as compared to the other side that did not get that gel applied. So here is how you would apply that after a surgical procedure.
Dr. Walter Tetch here. This is a case of 0 and 6 reconstruction with immediate temporization. We're going to apply right after the surgery StellaLife VEGA oral gel over the surgical side with the suture line and then the vestibule. We bring the patient back 15 minutes later for delivery of the temporary prosthesis. You can see the tissue is already responding quite nicely. You can see the nice and pink color there and very minimal bleeding. The patient is going to continue with StellaLife recovery kit for the next week, and then when we bring the patient back in a week for post-operative appointment, we're going to evaluate the soft tissue. And where we're looking at the soft tissue a week later, you can see the tissue is already responding very, very nicely.
Always great to have that gel on hand chair side for all of those different applications. And as far as pain management is concerned, this is our pain management protocol from our oral surgeon on team. And you can see that it does not include opioids. So we actually have a video that we provide for our doctors. You can use this video on your website or for a presentation chair side for your patients. And it basically states that you are taking a stand against using chemicals and opioids in your practice. And you are using the natural products, the StellaLife, and we can actually put your practice logo on this video so that you can stand apart from the other doctors in your area that don't have these natural products in your practice. This also includes a 30-second video of how to use the recovery kit. So it's great instructional video for your patients. We have seen overall a reduction in the need for pain medication, especially opioids, with our surgical doctors. And this was published in the American Association of Oral and Maxillofacial Surgeons, showing the huge decrease in the need for opioids with surgical procedures by Dr. Tatch. And this study was published by Drs. Lee and Suzuki. Dr. Suzuki was a previous chair of the dental arm of the FDA, and we did not know that they were doing this study. They purchased some recovery kits from StellaLife and then did the study on postoperative analgesia following bone block, a graft surgery of the mandible. So we were delighted to see this. Again, showing that you can comfortably do these procedures for the patients, and you will also find that they will heal much more quickly. So for non-surgical procedures, we all have patients that have dry mouth, many types of inflammatory conditions, aphthous ulcers, herpes simplex lesions. The StellaLife gel is very effective for that. Denture sores as well will benefit from using the StellaLife products to accelerate the healing and to reduce the pain with these lesions. In orthodontics, if a patient is in traditional braces, they often will have traumatized tissue, the cheeks and the lips. So the StellaLife products help to relieve that, especially the gel. And for clear aligners, the gel can also be put into those aligners as the patient transition between trays, especially when rotation is being placed on a tooth. It'll provide relief within 1 to 3 minutes that will last up to 3 hours. So many applications for non-surgical procedures. For canker sores, Dr. Scott Fromm, a well-known periodontist researcher, wrote this article, which this article and all of the other articles in this presentation, you can read in their entirety on the StellaLife.com website. There's a lot of great information there. And in this particular article, Dr. Fromm talks about using the gel for aphthous ulcers. So he was able to demonstrate that you can not only relieve pain, again, within 1 to 3 minutes, they can apply as needed, but it also will reduce the duration of the ulcer. So getting much more rapid healing and comfort for that patient. These can be excruciating, especially for people that get this on a regular basis. He also published this article about COVID tongue, which is a condition we're seeing with some COVID-19 patients, some of the long haulers as well. It's very, very painful. And he found that using the rinse provided relief, reducing dryness and inflammation, and it helped to get these patients to recover more quickly. And the gel can also be applied on these types of lesions or any other lesions to provide even more relief and to, again, help them get through these lesions and heal more quickly. For hygiene applications and perio applications, we have many of our hygienists using the StellaLifeRinse as irrigation after SRPs and in conjunction with periodontal maintenance. So you can simply place the rinse in an endosyringe and use it as a medicament in the areas that were treated during the SRP. We can also put the gel on the sites after the rinse is irrigated with. And what happens is you're able to reduce the level of inflammation, reduce the level of bleeding, and the level of discomfort for these patients after the anesthetic wears off. And if you have a patient that you anticipate is going to have a lot of bleeding, or a patient that you know is going to be really sensitive after the procedure, then the recovery kit would be the product of choice to use. They will start using this 3 days before the procedure. And by the time you see them, there'll be less inflammation and bleeding. And again, they will heal more quickly and be very comfortable during that healing process. And because perio patients do have pathogens above threshold, we're able to control those pathogens on a long-term basis by having them use the StellaLifeRinse, and they can use either the coconut or the peppermint flavor on an ongoing basis for full mouth disinfection. Because we know from microchem testing that we've done that the StellaLifeRinse is effective against anaerobic bacteria, against these pathogens. P. gingivalis, we definitely want to knock that out of our patients' bodies, as that is related to many diseases of the body, including Alzheimer's and dementia. So we are in a position to actually help our patients live a longer and healthier life by eliminating these deadly pathogens and help to create a healthy oral microbiome, because StellaLife rinses are specific for the pathogens, but will not disrupt the commensal bacteria that control our hormones and blood pressure. So we can keep a nice, again, well-balanced, healthy oral microbiome. The rinse is also effective against strep mutans. And this is really excellent for a Canberra protocol. If you're doing caries infection therapy for your patients, those high-risk caries patients, you would use this rinse as the disinfectant, and then use whatever fluoride or remineralization products you would normally give to them after they've done the disinfection. It is effective against strep mutans. So with patients that have dry mouth, they are more susceptible to caries, you can have them use this rinse for daily hydration, and it's going to reduce their caries risk as well. So a great all-around product for these patients, especially those elderly patients with dry mouth due to aging and or medications that people are using. This is going to help them stay healthy, more comfortable, and to reduce that caries risk. So we know from many studies that have been done that there are issues with chlorhexidine, which we've been commonly using for decades. We know that it does disrupt healing. It actually inhibits osteoblasts and fibroblasts and causes inflammation. We've all dealt with the staining, and the patients have to deal with the burning and the not very good flavor. So with StellaLife, we're able to provide disinfection, but we're not going to have any of these side effects. In fact, some university studies that have been recently done have shown that there is no toxicity with StellaLife as compared to chlorhexidine and other products. This study done by Dr. Rick Myron and his team at the University of Bern demonstrated no toxicity with StellaLife, but he also found that the use of StellaLife, we will see an increase in the growth of human fibroblasts. They replicate more quickly, and thereby we see more rapid collagen synthesis. So now we see why we've been witnessing this accelerated healing for so many years with StellaLife. This study was done here at the University of Texas, which also compared StellaLife to different products out there and found that StellaLife was non-toxic. And again, because it does help to accelerate the replication of the fibroblasts, we are seeing more rapid collagen synthesis, and there's no toxicity to those cells or the stem cells, which were demonstrated with the other products. So again, more and more studies are showing the benefits of the StellaLife rinse for accelerating healing. And in this study from the University of Indiana, the researchers compared chlorhexidine, povidone iodine, StellaLife Oral Care Gel and Parosciences Pro Advantage Gel to check for any cytotoxicity. And they found that the chlorhexidine, the iodine, and the Parosciences did exhibit the toxicity as far as the human gingival fibroblasts were concerned. But StellaLife actually encouraged the growth of human gingival fibroblasts with no toxicity. So again, as a comparison, the best option for the best clinical healing is the StellaLife VEGA Oral Care Gel. For dry mouth patients, the feedback we've been getting from these patients is that this is the best product they've ever used. They can use the rinse as often as they need to help them with their dry mouth. And if they have the extreme kind of dry mouth where their tongue sticks to the roof of their mouth, especially when they're sleeping, they can use the rinse and then put the gel on their tongue before bedtime so that they can have a more comfortable night's rest and not experience that the sticking of the tongue to the roof of the mouth. This patient had lichen planus and had tried steroids, which really did not give any long-term benefits to her. She tried the StellaLife rinse and gel after Dr. Sheldon recommended it for her and found a huge reduction in the lesions after just 1 week. And the burning that she was experiencing was gone. So this is a life changer for patients with conditions such as lichen planus or oral pemphigoid, where these patients have such extreme pain, they're afraid to brush their teeth and can't even eat a lot of times. So we can really, really improve these patients' lives. This patient was using an asthma inhaler, but not inhaling when he should have been as he pressed down on the applicator. So the medicine was building up on the buccal mucosa here. And he was given the recovery kit, which provided a great reduction in the lesion and relief of the pain that he was seeing. So again, we can help them use their inhalers properly and then give them something to help relieve their discomfort and to reduce these lesions for them. The gel was highly recommended by Gordon Christensen's group and was featured in the clinicians report, the October 2020 edition. So we are quite proud of that, as these are unbiased clinicians testing the gel and giving it high ratings. And through our microchem testing, we have found that a 2-minute rinse, which is the recommended rinse for the best therapeutic benefits of the coconut and the mint rinse, a 2-minute rinse is effective against human coronavirus. We also were, through the testing, found that our hand sanitizer, which does exceed FDA standards as a hand sanitizer, is effective against human coronavirus. And because it has many essential oils and aloe vera and vitamin E oil in it, is very hydrating and very soothing as well. So we have won numerous awards. The Oral Care Recovery Kit was given the top oral healing product from the Dental Advisor, and the gel has been acknowledged and won awards from the Dental Advisor. And we are in the top 5 of the top 100 dental products report. And this is all based on clinicians and patients' reviews. And you can actually hear these testimonials from clinicians and patients alike on our StellaLife.com website. And there's a lot of information there. And I just want to go over the use of the products with you. So we have the rinse, which is a standalone product, the mint, and the coconut. So the coconut rinse has twice as many protective ingredients as the mint rinse. And we created it in a response to those patients who are sensitive to mint, patients that have burning mouth or burning tongue, and also the oncology patients. Patients going through cancer treatment, chemotherapy, or radiation of the head or neck, as you know, will often get excruciatingly painful mucositis. And when they use the StellaLife products, ideally the recovery kit, they find that they don't get these to the same extent and can remain comfortable and are able to eat as they're battling their cancer. So the rinse is basically what replaces chlorhexidine. It is a standalone product. We also have the gel, which is available on its own to be used for aphthous ulcers, to be used chairside at the end of procedures, surgical procedures. Anytime that there's a lesion that the patient presents with, you can put the gel on it so they're comfortable and complete the procedure that they have been scheduled with you on that day. Then the recovery kit includes the rinse and the gel, but it also has a sublingual spray. And that spray has all of the ingredients of the gel in a form that is going to get into the patient's bloodstream. And this is what provides the preemptive analgesia when the patient uses the recovery kit starting 3 days before the procedure, using all three products 3 times a day, which is the 333 StellaLife program. And you can see on the right side of the screen the instructions for using the recovery kit, and they are also on the recovery kit packaging itself. And here's a quick video demonstrating this.
With StellaLife, you can return to your normal life much faster after dental surgery. StellaLife is a safe and natural way to speed up recovery after oral surgery. Better ingredients, better formulations, better healing.
So we want to help your business growth as well. So we will put your practice on our website under your zip code. And we will also allow you to have Schedule Widget, which is a service you would ordinarily pay for, but it's complementary to our StellaLife providers. So when patients find you on our website under your zip code, you will get their contact information, and you can even have them schedule an appointment in pre-blocks that you set up through StellaLife website and Schedule Widget. So we want to help you with your practice growth. And here's a video from many doctors using StellaLife.
StellaLife is on a mission to improve people's lives by accelerating healing, relieving pain, and reducing the need for opioids and steroids.
I can tell you that across the board, it's been an amazing experience for all of us, for my staff, certainly for me, and most importantly for our patients, because the feedback has been tremendous.
I've done over 150 cases and photo documented them. The healing at 1 week looks like 4 weeks.
We've been able to reduce the number of opioids that we prescribe in our practice almost fourfold in the last 3 years.
In the past, I would see wounds opening up, I would see membranes not only exposed but being lost, I would see bone grafts being lost, and can't say I would always attribute that to the chlorhexidine, but the use of the oral care program has just been really spectacular, and I love the overall wound healing that I'm seeing.
Where my assistants came to me and said, let's use this for every patient. Why? Because we're prescribing a lot less pain medications as a result.
It was a pure miracle, the difference in night and day and waking up without dry mouth.
Oh, this is the best product that I've ever had. I have a cancer patient with a melanodosis that is on chemotherapy. It's the only thing that allows her to eat.
We could not imagine practicing without StellaLife in our practice today.
So with StellaLife, you will have your patients have a better experience with less pain, less swelling, less opioids, natural healing. And dispensing from your practice will definitely help your bottom line. So we're here to help. I want to thank you for your time today. We want to partner with you for better clinical results and increased practice growth.